Welcome to this presentation about persistent low back pain. It's been created by physiotherapists working in Swansea Bay healthboard, Osian, Griffiths, Stephanie Jemphreys and myself, Damian Wilkinson. When you clicked on this link, you were probably looking for ways to help your low back pain. If so, you're in the right place. Low back pain is a very common condition and most people will experience this during their lifetime. This means that many people you know will have had back pain, and many will want to discuss their experiences and recommendations with you. In addition, there are many healthcare professionals who recommend different treatments and who practice in different ways. This can be conflicting, confusing, and frustrating. Fortunately, there is a body of scientific literature available to help us make good choices about healthcare. The National Institute for Clinical Excellence, or NICE for short, regularly scour the worldwide scientific literature and make recommendations based on this. In the NICE guidelines for low back pain, they make several recommendations for treatment of persistent or chronic low back pain, and also recommendations about what to avoid, treatments such as acupuncture, ultrasound, opioids and spinal injections. This presentation aims to clarify some of this information to help you make some informed choices about how to manage persistent low back pain. We'll deal specifically with two areas of treatment which are recommended by the NICE guidelines: education and exercise. So before getting straight into it, here's what to expect. We'll start with looking at some of the common myths, scare stories and misconceptions about back pain. There's quite a few. It might be very reassuring for some to hear some of the things that we now know about persistent low back pain. Facts, not fictions. And why this changes some commonly held beliefs such as always rest when it hurts or my discs are crumbling. We'll also talk about why we all hurt sometimes and how an effective pain system can help you survive and why our pain system doesn't always work well for us. Finally, we'll use what we know to offer advice and practical planning, thinking and exercise strategies to help move, cope and live better with persistent low back pain. Back pain can be worrying, but the spine is one of the strongest parts of the human body. It's surrounded by a network of ligaments and muscles that work together to allow the spine to move and also help to stabilise it. Your back can take it. Think of how readily your back can adapt to sport, to activities, to lifting, to bending. Backs are very strong. A lot of back pain begins with no injury or from an everyday movement. If you have had an injury, tissue healing occurs within 3 months or so, so when pain continues past this, it often means there's other factors contributing to this. These are often related to tension, fatigue, stress, inactivity or an activity that we're not used to. And it makes the back sensitive to loads and movement. It doesn't make it weak. Some myths about back pain. Myth number 1. My back is worn out. Research doesn't support that widespread belief that getting older causes or worsens back pain. Think of a pain-free part of your body. Well, that's the same age as your back. Why doesn't that hurt? Evidence-based treatment can help at all ages, and we know that lifting weights strengthens our muscles. Backs don't wear out with lifting and moving. In fact, moving, twisting, lifting, bending are safe to do if you start gradually and practice regularly. Myth 2. Lots of pain means something is really wrong. Well, persistent back pain can be very severe and it may be scary, but it is rarely dangerous. Part of a good clinical examination is to ensure that there is no serious pathology. A good health professional examining you for back pain will ask if you've had recent bladder or bowel changes, pins and needles between your legs around your upper inner thighs, if you're walking with an uncontrolled, staggering gait as if you're drunk, or if you have new pins and needles in both feet. If so, they would advise you about the best course of action, usually that you should attend the emergency department. They'd ask other questions regarding weight and health issues and recent trauma and so on, and all of these would affect their decision on what to do next, but they will always make sure you are safe before proceeding to treatment. A health professional can then guide you on what to do next. Now, reassuringly, only 1 to 2% of low back pain is from a serious pathology. Myth number 3. A scan will show what's wrong. Although in a small number of people scans are necessary, they can't be trusted to show the cause of back pain. Scan reports sound scary. They show findings like disc bulges, protrusions, degeneration, and arthritic change. Amazingly, these findings are equally common in people who don't have back pain. A scan can't predict the amount of pain you have, or where it comes from, or how you should treat it. 60% of the population have a disc bulge. Some have pain and some don't. Age-related changes happen to joints, as to skin and hair, and just as we can tell a person's age from looking at them, scans reflect these normal changes to our body, like wrinkles but on the inside. More myths about back pain. Number 4. Exercise will damage my back. Activity and exercise may hurt, but this does not mean it's harmful. Backs don't wear out by bending, lifting and twisting, but they're nourished by these activities, which create strong muscles, bones, joints and ligaments. Done in the right way, exercise can be a painkiller and a healer, creating all sorts of beneficial conditions for healing and repairing your body, leading to a reduction in pain, pain-related fear and worry, a better quality of life, and a host of positive effects discussed later in this presentation. Remember, backs are very strong, and persistent back pain is rarely linked to serious tissue damage. Having said that, flare-ups of pain may well be scary and painful, but these are rarely caused by regular exercise. Most commonly, they're linked to inactivity, poor sleep, tension, worry, stress, and new activity overload. By controlling these things, we can often prevent flare-ups. Stay calm, keep yourself moving, don't worry about unlikely future events or damage. In fact, thoughts like I could end up in a wheelchair actually make us worry and hurt even more. Myth number 5. It's my weak core. Other worrying thoughts include thoughts of back pain being caused by weakness. Many health professionals and others have suggested that a weak core is to blame for back pain. Although it's true that people with back pain show changes in muscle activity of some deep stomach muscles known as the core, we suspect that this is as a result of having back pain, not as a cause of it. Core strengthening exercises are useful in managing low back pain, but so are other trunk strength exercises or walking. The thing these treatments have in common is that they are exercise. Whether they treat the core or the lower limb and the trunk or the heart and lungs has not been shown to be more or less effective one way or the other. They have all been shown to work. People with back pain will often tense their core to protect themselves, similar to keeping their fist clenched after spraining your wrist. But this can add to pain if we do it too often. Actually, instead of trying to brace your core and hold yourself tight, being able to relax and switch on or off your muscles is more helpful during everyday tasks. Myth number 6. It's my posture. Posture is often blamed for back pain. It leads people to try to hold themselves upright all the time. Yet, as in the myth of a weak core, back pain's not caused by poor posture either. It's really safe to relax, to change positions during everyday activities like bending, lifting and sitting, even to slouch. Your back would have evolved to be a plank if being held in one correct position was the best way, when in fact we've evolved to bend, lift, twist and curve as well as stand up straight. Moving like this, often and in a variety of ways, is nearly always healthier than maintaining a straight back for prolonged periods of time. So, if back pain is not about bad posture, a weak core, changes in your joints on an MRI, or bending and lifting, what is it about? If it doesn't indicate damage, why does it hurt? In a word, pain is there for one reason, and that is protection. When you put your hand onto a hot stove, you need your pain system to work quickly to make you change your behaviour. Pain stimulates all sorts of helpful responses. You snatch your hand away, preventing further burning. You shout out loudly, letting other people know that there is danger and that you are hurt. And you run your hand quickly under the cold tap, and perhaps most importantly, you don't do it again. You've learned that something is bad for you through your pain system detecting thermal changes in the skin receptors, your brain recognizing that this is a threat to your health, and then causing you to react in all those helpful ways. This is why pain is useful. On the other hand, there's not always damage to our bodies when the pain system kicks in, merely a need to protect us. Take an example of stubbed toes. Toes are small bones, they're necessary for walking and balance, yet they're vulnerable. They're perched right at the end of our feet and they don't have layers and layers of strong muscles to protect them like our back. Our pain system, however, is strongly wired to help out with protecting our toes. When we stub a toe, we shout and hop, cry, swear, hold the toe. But very soon after, the pain goes away without a mark on the skin, no redness, no swelling, no bruising. Although there's no damage, there was undisputedly a lot of pain. So there we go, our pain was protecting our toes. We make sure we're more careful the next time we walk past that brick on the floor. This protective, well-functioning pain is usually known as acute pain. It happens during an injury. It'll heal in a short time. It'll cause us to avoid further damage. And it's easily treated with ice, rest, and painkillers. In contrast with acute pain, which serves us and protects us very well, persistent pain is a very different thing. Although it may start as acute pain from an injury, the pain persists long after the injury heals, often without a clear cause, and it can occur and recur for months. The NICE guidelines suggest that about a third of people who have acute back pain still have pain or episodes of pain 1 year later. Damage is usually healed by then, but the pain persists or worsens over time without a clear reason. Now, although this pain may persist or worsen, this does not indicate new damage. In persistent pain, repeated stimulation of the nervous system leads the nervous system to become oversensitive. Our pain system becomes an alarm which is triggered wrongly and too often, like a car alarm that keeps going off. It's unhelpful. It doesn't tell us that a car thief is breaking in, or that the wind is blown, or a cat's on the roof of the car. This repeated triggering of our alarm system in our bodies causes it to malfunction. It makes our pain threshold lower, and it makes our responses to pain more pronounced. Because we think that there is ongoing danger and damage, we continue to avoid using the affected part. We protect it, we worry about it, and we use more and more things to try to get rid of it. Unfortunately, this further affects the way our nerves work, causing them to become even more oversensitive. This is an unhelpful, vicious circle. The more we try to avoid the pain, the more the pain increases as a result, even though there's no new damage. In persistent pain, what we see are high levels of pain, but this does not represent high levels of damage. What it shows is that our alarm system is highly sensitive and easily triggered. Our pain system can become sensitized and can be flared up more easily with less and less stimulation, like bending to pick up a pen or turning around or standing up. Worse, When our pain system starts to malfunction, it learns these painful responses to simple movements and gets better at producing pain with less and less of the original movement, leading us to want to do those movements less and less. Our alarm system is no longer helping us stay healthy and safe. It's now doing the opposite. When, despite our best efforts, we're still in pain, we can respond in all sorts of unhelpful ways and worsen our pain. Complex emotional, mental, and social behaviours are powerful influences of pain and often act in worsening cycles where one thing causes another thing, which in turn worsens the original effect. Worrying about the cause of our pain and thinking about it regularly causes distress. This may be driven by fear of not being able to get to work or of the pain getting worse. We can often get into a habit of negative thinking, which leads to more and more worry and stress. Well-meaning friends and family who are overprotective can add fuel to the flames with their own worrying thoughts and contribute to the difficulties of managing persistent pain. A stress response triggered by worrying thoughts has the same effect as a shock or a fright. Our fight or flight response is kick-started. It floods our system with adrenaline and other stress chemicals, and this worsens the pain. Similarly, lack of sleep can be a vicious circle, which not only causes tiredness but also causes chemical and hormonal changes in our systems. That increases our pain, that makes it harder to sleep, and round it goes. Lack of physical activity also has a profound effect on our physical, psychological, and emotional health. Yet avoiding things and resting often seem like the only things we can do to alleviate pain. We'll discuss this later when we talk about boom and bust activity cycles. Drug and alcohol consumption can in the short term provide some change to our usual state, but also they usually lead to worse pain control in the long term and cyclical behaviours. Our pain system needs healthy behaviours to become healthy. Excessive drug and alcohol use is actively harmful. Painkillers should always be taken in safe, steady doses under the guidance of a health professional. For all these reasons, it's very difficult to isolate one cause or one treatment for persistent pain. Instead, persistent pain has been shown to benefit more from holistic treatment, aiming to make positive changes on a range of things involved. Holistic treatment has been shown to have much more benefit than single, isolated treatments, such as medication or exercise, or click or manipulation, or anything else that people might try on its own. So what is holistic treatment? Holistic treatment involves understanding pain and its functions, which we've discussed so far. It involves understanding our thoughts and beliefs about pain, noticing when we're getting into a spiral of worry and knowing this is likely to worsen our pain. This can allow us the opportunity to redirect our thoughts elsewhere. Holistic treatment involves helping us choose healthy lifestyles, involving good nutrition, enough sleep, time for relaxation and managing stress. This causes beneficial responses in our body chemistry, and it can significantly improve pain. Correct medication taken at the right time, under the guidance of a professional, is another useful tool to get us going. Healthy behaviours such as exercising in a paced and planned way can allow us more opportunities to get fitter and stronger, and we'll discuss that now. So what does exercise do? Done in the right amount, when you raise your heart rate, contract your muscles and move your joints, you have a huge beneficial effect on your body and mind. Exercise protects and nourishes cartilage. It strengthens muscles and bones. It improves your cardiovascular system, your balance system. It releases chemicals which improve mood, concentration and sleep. It helps you do more of the things you like. It improves your quality of life. And if that weren't enough, exercise decreases the risk of obesity, of high blood pressure, of diabetes, of heart disease, of stroke, of Alzheimer's. For a really excellent resource to look at on the value of exercise, check out Dr. Mike Evans' YouTube clip. It's called 23 and a half hours, and it's included in our resources list on the Swansea Bay website. When you have low back pain, don't fall into the trap of doing too much exercise or activity too soon. It can cause more pain than it's worth. When we have persistent low back pain, exercising a lot can be too much for us and it can cause more pain. More pain leads to more rest, and longer rests lead to stiffness, weakness and deconditioning of our body's muscles and joints because they need regular movement to stay healthy. Obviously, this also affects our mood, and then that further demotivates us to move when we're in pain. It's the boom-bust cycle, and when we're in this cycle, we often wait until the pain eases before we start doing things again. Unfortunately, this pattern tends to repeat itself because we keep trying to do more than we're capable of. We don't seem to learn. It's a bit like a marathon runner who sets off at a sprint and can't finish the race. If we learn from our experiences, we have to look at pacing ourselves as a way to get a better outcome. Poor pacing, poor outcomes. But what is poor pacing? In the cycle of activity we just talked about, pain causing over-rest, continuing over time, muscles are going to become weaker, joints will become stiffer, your heart and your lungs will work less effectively. What this means to us is that we get less fit. The ability to move lessens. Without activity and exercise, your body produces less of the chemicals which promote good mood, good concentration, good sleep, and good pain control. This can actually result in increasing levels of pain and a worsening quality of life, as we're less and less able to do the things we love. Good pacing, on the other hand, leads to good outcomes. With good pacing, we limit the amount we do initially to allow us to cope with the day's tasks and activities without causing a flare-up. This may initially mean doing less than we usually would, but in this situation, doing less can lead to doing more. Exercise takes quite a while to strengthen our musculoskeletal system, and it must be done regularly in order to affect us positively. When we do good pacing, we allow our bodies to adapt and maintain our improvements, as we don't keep breaking the regularity of our exercise by having to rest for long periods. So how do we use pacing to start exercising easily and safely? First things first, you have to start somewhere. So always start slowly and gently. Guidelines recommend that adults do 30 minutes of moderate activity 5 times per week, but don't worry if you start at 1 minute per day. The important thing is to begin. The next most important thing is to continue. If it hurts a little, don't worry. Exercise takes weeks and months to be effective, not a few days, so stick at it. It's worth it in the end. However, if it does hurt for more than 1 hour after the exercises, adapt. Reduce the amount that you do. When the pain comes back to its normal level, start at the beginning again. Once your pain and your exercise routine is regular and steady and manageable, build up. Build up your repetitions. Build up the amount of resistance that you use, or the amount of time, and do it slowly. So let's get going. Rather than giving a prescription of exercises which must be done for this number of repetitions this many times per day, here's some examples of useful exercises for you to try in small doses as you are able. Firstly, walking has been shown to be effective in managing low back pain, as well as being easy, accessible, and a great way to catch up with friends. Squatting is a very useful movement. It strengthens many muscles simultaneously. To perform this, standing in front of a chair, bend your knees, Stick your bottom out towards the seat and raise your arms in front of you, as shown in the picture on the right. Either sit for a few seconds and stand up, or touch the chair gently with your bottom and return to standing immediately. Thirdly, bending sideways. Bending sideways backwards and forwards, as shown in the bottom pictures, can be done gently and painlessly in small doses at first. Starting with the picture on the right, stand upright, hands on the outside of your hips. Bend to one side, running your hand down your leg and keep your chest facing forwards. Move a few centimetres down the leg at first, and then the other way. Build up the distance you reach over several weeks. The next exercise, lying on your tummy, is a back bend. Pushing up with your hands is the easier version. Raising your head and shoulders off the floor without using your hands is one to try later on, once you could do the first one quite comfortably. The last exercise is bending forwards, but doing it lying down, so very easy. Lying on your back, bend both knees, grab hold of one, and just gently ease the knee in towards your chest. Hold it for a few seconds, and then change legs. Repeat all these exercises once. If once is easy, try twice in a few days' time. As these exercises become easier, and they will, try the following exercises. Number 1, lunges. Stand facing forwards with your hands on your hips. Step forwards and bend the front knee a bit. Just a bit at first. And then build up to a deeper angle as in the picture, keeping your front knee pointing forwards. Number 2, walk up and down the stairs. This is a really good workout for your heart and lungs, as well as your back, your hips and your thighs. As is number 3, get on the exercise bike. This can be very comfortable for some people who have back pain when standing or walking. So if you can't do the stairs, try the bike. It can be pain-free. It can allow a really good workout when you've built up to it. Number 4, lift something from the floor. To do this, breathe gently out, bend your knees, stick your bottom out as though sitting down, and lean forwards, taking hold of the weight on the floor. Lift the weight smoothly and slowly back to upright, keeping it close to your legs. Move in a relaxed way. Don't brace your back, because you're lifting a very light weight at first. Other things you could do to help persistent pain include keeping active. Remember, the recommendations to maintain health are for 30 minutes of moderate activity 5 times per week. You could set goals to help you get there. 5 minutes walk per day for a week, 6 or 7 minutes walk the following week. Things like this. Split a task into manageable chunks, something that is within your reach rather than a distant dream. Another thing you could do is improve your sleep. Things like reducing or eliminating alcohol, having a relaxing bedtime routine and no blue light screens for an hour before bed, darkening the room and ensuring a room is quiet and cool are all useful ways to start. I'm sure you can be creative and think of other things. You can also focus on other things besides your pain. Distraction has been shown to be a painkiller. Doing things you enjoy will help you shift focus away from your pain. It'll give you a sense of satisfaction, and it should help you to relax. Relaxing helps you manage your stress, and managing stress helps us deal with pain. Stressful situations lower our pain tolerance. Avoiding these situations can improve it. So, to summarise, we started by talking about how X-rays and MRIs of the back can show normal changes regardless of whether or not we have pain. A picture in this case often tells a completely unrelated story to our pain. Speaking of stories, we talked about how there's many scary stories and myths about back pain. But back pain doesn't always get worse, and it's rarely dangerous. Remember, pain does not mean damage. We talked about how persistent pain is really complex in its causes, and it's unlikely to be treated well with just one thing. There's no miracle cures, but there's many things which will help, and there's some things which won't. Avoidance of movement and exercise doesn't help, for example. This affects both physical and mental health. Equally, too much movement and exercise can aggravate pain with similar negative consequences. If you hit the middle ground, back pain can be treated safely with small, gradually increasing amounts of exercise. And back pain can improve when we choose helpful ways of thinking and behaving, reducing our stress levels, improving our sleep, and focusing on other enjoyable things besides pain. So we hope this has been useful. There's some useful resources available in these web links on the Swansea Bay Healthboard Physiotherapy website, but this is by no means a complete list. Look around your local area to find opportunities to move, to exercise and to do things that you enjoy. And good luck.